The coronavirus pandemic, as we now know it, will eventually end, but not in the way you might think. History offers important lessons.
The only epidemic or infectious disease that has ended biologically is smallpox. And so there is very little precedent in how something ends biologically.
You follow the late phases of the smallpox eradication program, which focused intense surveillance and policing.
The question was asked over and over again, have you seen anyone who looks like this?
There's a bit of a hubris that takes place in the field of biomedicine, this notion that all infectious diseases could ultimately be conquered.
Usually, viruses don't go away. Strains of the seasonal flu, for example, are descendants of the 1918 influenza pandemic.
Well, of course, there was no vaccine for anyone in 1918. The pandemic, I think, ended really when the vast majority of the population was exposed to the virus and the immune system became capable of dealing with the virus.
This is part of the basis of moving towards calculations of herd immunity. We're at a moment in which 60 to 80% of the American population has been vaccinated or has otherwise acquired immunity against COVID, and the epidemic has not ended. We are now experiencing some of the limitations of a vaccine-centric public health response.
The kind of global inequalities that are coded into the global health structure, that it takes years for a vaccine to really be an efficient way of managing an epidemic.
It's not surprising that we see new variants.
Tonight, the Delta variant fueling an alarming rise in cases across this country.
A troubling new variant of the virus.
But what happens globally will impact us. So if we get more people vaccinated globally and more people vaccinated now, hopefully within a reasonable period of time, we will get to that point where it might occasionally be up and down in the background, but it won't dominate us the way it's doing right now.
Experts say COVID-19 will likely transition into an endemic disease, existing permanently in a population like the measles, chickenpox, or HIV.
The analogy I would make here is that as HIV moved from a death sentence to a treatable chronic condition, it became more like diabetes, another endemic disease that we simply think of as part of everyday life and can be managed with proper resources.
Historians also say epidemics end when they disappear from public consciousness, but that doesn't mean the threat is gone.
The history of prior pandemics teaches us that once a disease is no longer considered to be a concern or a risk for an affluent or mainstream or middle class, that it can disappear from view.
So that's one of the ways that epidemics end. We don't think about them anymore.
The Ebola pandemic, once that pandemic was declared over,
NGOs and international aid pulls out of regions that are still very much struggling with the disease.
As soon as there is a declaration that this pandemic is over, we need to ask, over for whom?
COVID theoretically could turn into a disease that's not a problem in places that have adequate health infrastructure and access to healthcare, but would be still continue to be a problem in other places. So the people with long COVID, the people who have lost family members, friends, and so on, who will continue to live with that loss. So I think we need to be very careful when we're thinking about that ending to make space for these various problems and various ways that the epidemic lives on.